Okay, we're on Facebook now.
Hi, good afternoon, and welcome to another edition of Let's Talk COVID. And today we'll be discussing testing, contact tracing, and also Public Health 101 with a special feature on environmental health. So these Let's Talk series are a chance for us in Buncombe County to hear from community and hear from experts on all those things related to COVID. And so this is a chance for us to hear for all those folks who are living in Buncombe County, new information that can help us all be as informed and also as engaged in collective action in our local COVID-19 response. We've got a great panel of contributors today. And with that, I would like to open the floor and let them all introduce you and tell you a little bit more about their background and what they'll be talking about today.
Hi, thank you for the invite. My name is Amparo Acosta, and I'm one of the public health nurse supervisors in clinical services at the Buncombe County Health and Human Services organization in the county. I supervise the communicable disease nurses and some nurses in the clinic. And I've been working in public health for Buncombe County for 18 years.
Welcome.
Good afternoon, everybody. Thank you so much for having me on. My name is Charlie Cox. I'm the Fire Life Safety Educator for the Asheville Fire Department, and we've been assisting Buncombe County Health and Human Services with the COVID-19 testing out in the community. And I'm here to give a little bit more information on the Buncombe County Community Connect.
Good afternoon, everybody. My name is Jennifer Mullendor, and I am the Interim Health Director and the Medical Director for Buncombe County Health and Human Services. And I'm going to be talking today about testing, who should get tested, and where you can get tested, and everything related to testing. So thanks for having me.
Great. And with that,
Hello, everyone. I'm Jessica Silver. I am with Buncombe County Health and Human Services, Environmental Health Section. I am the Environmental Health Program Administrator. And today I'm going to talk about everything environmental health and environmental health actions with response to COVID-19.
Great. And so why don't we kick off things with you, Jessica? If you can tell us a little bit more about, just generally, what is public health? And what would you like, the public to know about the work that you've been doing and your department's unique role in the effort?
Sure. So I guess the easiest thing to start off with is what we normally do, what environmental health normally does. So in a normal operating time pre-COVID and during COVID and even after COVID, our response or responsibility to our community is to help promote and protect the environment through various regulatory and educational opportunities. There are two main sections within environmental health. There's the on-site wastewater section that is responsible for issuing septic and well permits and ensuring safe water quality. and we're still operating in that function. What we have noticed with COVID-19 is everyone is staying home and staying safe, especially in the first phase. And as people continue to work from home and children are home from various summer activities that they would usually be enrolled in, we have seen an increase in the number of septic system failures. So our staff have been busy coming up with ways that septic systems can be repaired safely, both for the homeowner and for our environment, and also through keeping septic systems functioning properly, we are ensuring a safe drinking water supply for all of our community members. And that's a vital resource that we offer within the community. And the other section of environmental health is the food and lodging section. And pre-COVID, during COVID, and post-COVID, our responsibilities are to inspect restaurants. You all are familiar with seeing the grade card as you go around the various food service establishments. We also inspect swimming pools and permit those pools to ensure everyone's safety while they are swimming and relaxing on a hot summer day. The food and lodging section also inspects nursing homes, and during COVID-19 response, our staff have been involved in making visits to long-term care facilities to ensure that they are operating as safely as possible, using good hand washing methods, the correct disinfecting solution to clean the surfaces to help protect or prevent COVID transmission. So environmental health is all over the community. One of our larger functions directly related to COVID throughout this response has been staffing and functioning as a contact and a liaison on site at our isolation and quarantine housing that's set up in the community. And we see that as the most vital response from environmental health's perspective throughout COVID. Isolation and quarantine housing is available for anyone who is identified as being COVID positive or either a close contact of a COVID positive person. And that housing is offered when someone, for whatever reason, cannot safely isolate or quarantine at their homes. And some of those reasons could be they have an elderly family member that they're taking care of, or their house is set up in a way that they can't safely quarantine or isolate themselves from other members of their household. Or it could be someone who is in transition or in between housing. So we have served quite a few members of our community, and we're really proud of that work and proud of the dedication from our staff that we're seeing. The work that everyone within the environmental health team has just been astounding. It's been really great to be able to be that resource and the quote unquote go-to people for the community in that way, because we know by providing this resource, isolation and quarantine, we are making steps and taking the necessary steps to limit or reduce transmission within our community.
That's great. So we and you did mention that, folks are putting a lot of burden, let's say, on their septic tanks because they're home. So maybe there's a few more laundry loads that they're doing since, they have a little bit more time. What other kind of things are you seeing that the community may be better, whether it's outside the home or inside their home, related to our environmental health efforts?
That's a great question. If you all remember when COVID first started, if you went to the grocery stores, it was just about, or you went shopping, it was nearly impossible to find toilet paper, right? That's a staple that we all use every day. And the majority of us probably don't think about how much we're using. And at the end of the day, when we flush, it all goes somewhere, right? So when you consider the amount of toilet paper, the more, you have more people that are staying at home, they're really stressing their septic systems in that way. And if you are not on a septic system, we are also encouraging you to be conservative with your water usage. Practice those water conservation methods. For instance, instead of washing your car in your driveway, maybe take the ride, get out of the house and take the ride to the car wash. That's somewhere where you can socially distance. You can practice the 3 W's and get a change of scenery, but you're also not adding to the stress on your septic system. Other things that people are doing at home just to protect their families include using really strong cleansers or disinfectants. So we want to remind you to be really mindful of how much of that you are actually flushing down into your septic system or even into your sewer system. The goal of it all should be to limit the amount of disinfecting or sanitizing solutions or cleaning solutions that you are using, and controlling how much you are actually putting into either a septic system or sewer system. We often don't think about a septic system as having good bacteria in it, quote unquote, good bacteria, right? But there are some good bacteria that need to be housed in a septic tank in order for that tank to work properly. And so just be mindful of how much cleaning and how much laundry you're doing. Those are the things that we're seeing and would like to caution people against.
Well, thank you so much for, all of those great tips. Also, I think that you were able to show us that environmental has many meanings. There's our built in our natural environment, but also how our home environments are also really a key piece of our stay-at-home efforts. And so with that, and just continuing kind of more our science component of this, we're going to now have our next contributor, who is Dr. Jennifer Mollendorf. As you all recall, she is our interim public health director and also our current Buncombe County medical director. Dr. M.
Thank you, Zoe. So I'm going to talk today about testing. And so if you've listened to the community updates, this will sound very similar to what I've mentioned before. And I know that there have been many iterations, many different versions of who should get tested throughout this response to this pandemic. But the good news is now that most people are able to get tested. And specifically, who testing is recommended for are anybody who has symptoms that suggest they could have COVID. And again, this is something that has changed over the course of the pandemic. So initially we focused on fever, chills, shortness of breath, and difficulty breathing. But that list has expanded greatly. And so now those are still on the list, but it also includes things like feeling really tired and fatigued, having muscle or body aches, having a headache, having sore throat, loss of taste or smell, nasal congestion or runny nose, nausea, vomiting, and diarrhea, which really runs, it's quite a broad variety of symptoms. And so what I like to tell people is if it's anything outside of your baseline, that could be a reason that you should get tested. And so reach out to your healthcare provider or seek testing. For other people who should get tested, so anybody who's identified as a close contact to a known case. And so if you are a close contact, hopefully you will have been reached out to by one of our contact tracers. or communicable disease nurses. And so we would definitely encourage testing. But even if somebody, for whatever reason, maybe didn't divulge that to our communicable disease nurses that you were a close contact, but told you that they had tested positive for COVID-19, we would want you to get tested. And then there's a wide array of individuals who, if they think they may have been exposed to COVID-19, and even again, if they have symptoms or even if they don't have symptoms, we would encourage testing for. And those would be people who live in or work in or have regular contact with certain high-risk settings. And so what are those high-risk settings? That would be our long-term care facilities or congregate care facilities, homeless shelters, jails and correctional facilities, and migrant farm worker camps. Other individuals who should seek testing if they think they've been exposed, again, whether or not they have symptoms, will be people who are at really high risk of severe illness with COVID-19. And so that would be people who are over the age of 65 and people of any age who have underlying health conditions. And so we're talking about 20-year-olds with diabetes, 30-year-olds with high blood pressure, basically people of any age who have some sort of underlying heart, lung disease or diabetes, something that could make their immune system weaker than normal. If you're at high risk for serious illness, again, if you think you've been exposed, we want you to get tested. And then the other population that we're really concerned about, based on what is the data is showing about COVID-19, would be individuals who live in historically or are members of historically marginalized populations. As the data has shown, both locally and within the state and nationwide, there is a disproportionate impact of COVID-19 on Black, Indigenous, and people of color communities, so that we're seeing high numbers of individuals that identify within those communities ending up sick with COVID-19 in the hospital or dying. And so it's really important that we're making testing available to all members of those populations. Again, other high-risk individuals would include healthcare workers or first responders. So we're talking about EMS personnel, law enforcement, fire department staff, or National Guard military staff. And then frontline and essential workers. So these are our grocery store workers, the gas station attendants, the people who are taking care of our children in childcare, construction workers, people who work at food packaging or food processing plants, people who are in these frontline essential jobs in settings where they might not be able to keep their physical distance from one another. And then finally, the guidance changed recently to include people who have attended mass gatherings. We know that the risk of getting COVID-19 increases when you are exposed to more people. And so when we're talking about mass gatherings, so we're talking about anything from parties and cookouts and graduation ceremonies and funerals and church services and marches and rallies and protests, anything where a large number of people are coming together in close proximity, where they're not able to keep that physical distance of 6 feet, where maybe people aren't wearing their face coverings like they should, that if people have attended any of those types of gatherings, we want them to get tested. We just know that that's just a really easy way that COVID can spread. And so we want to quickly identify individuals who might have gotten infected. And so we would say, if you meet any of those criteria and you want to get tested, first, contact your healthcare provider. We know that many healthcare providers in our community, ranging from pediatricians to family doctors to internal medicine docs, are doing COVID testing for their patients. So check with them first. And then if not, on our website, buncomready.org, there's a list of some other clinics like urgent cares who are offering testing for people who can't get it through their primary care provider. So that list is there. The state also now has a list. And so there are different facilities being added all the time across the state. And then we have our community testing sites, right? And so these are sites that are sponsored by Buncombe County in partnership with Western North Carolina Community Health Services. These are sites that offer free testing to people who don't have insurance, and there's no out-of-pocket cost for anybody who shows up at these community testing sites. We do ask that if you have health insurance, you bring your health insurance information, because we can bill insurance for the cost of the test, but you, as the person getting tested, should have no charge for the test. This week we're on hold right now as we actually set up for more permanent testing sites in the community. And what I mean by permanent would mean, like, for the next 10 weeks, we'll be at 3 different sites. You know, every Sunday we'll be at this site, every Tuesday we'll be at this site, and every Thursday we'll be at the site. So that more information is to follow soon on where those testing sites are and the hours. We're trying to make them more accessible to people who might work different shifts, and so that the testing can be available for everyone who needs it. And we also have provided and will continue to provide language services, so interpretation services at those community testing sites. I think I stop there. So if there's anything else, just let me know.
Well, thank you. I think that and maybe when we do open up to our panel discussion, if you could, later on, possibly recap a little bit more about why it is that some communities or some populations in our county may be more at risk. I think this is a perfect segue for us to first introduce another one of our panelists, and then also hear from her exactly what it's like to actually go to one of these community mobile testing sites. So Jennifer Poore with ABIPA wanted to introduce you. If you could please,
Can you hear me?
introduce yourself and tell us exactly how you've been supporting our local and equity-informed efforts in the COVID response locally. Thank you.
Well, my name is Jennifer Poore. I'm a community health worker and a community service connector with ABIPA. And how I support with the COVID-19 testing is, first of all, thank you, Buncombe County, for giving those testing free in the communities for people who really can't afford it. That's been a big issue, but I really appreciate you guys doing that, and being a part of it has been a big help to me, because it's something different and I've never experienced anything like it. And the people that comes through, you have some that are a little scared because of the actual testing. They say they take the Q-tip and put it all up in your nose and everything, and that was kind of scary for them. And they say, a lot of people say it hurts, whereas just being able to be in the front and trying to make people at ease before going in and get the testing, it's pretty great for me, because that's just like me going into a doctor's office and maybe getting good or bad news about a test results, but then when you have that front person there, they give you a little bit, make you feel at ease and calmer about the whole situation. I think that's what we bring at those testing sites, is to try to make sure people are calm. And a lot of people has a lot of questions. Do you do it this way? Do you do it that way? Do you take, I think it was something about some blood work, or do we do the blood work thing, or however? So we normally refer them to the next tent to get those questions asked. But being a part of the whole community-based testing, to me, is phenomenal. I learned a great deal, especially working with Charlie and some of the other people that we work with, and Jennifer, my namesake up there. Just listening to her, I just learned a great deal. And by me being in school, it's kind of like helped me out on which route I want to go. But yeah, but this is it's important. It really is important. I myself got tested, and I called my dad, who lives on the other side of town, and had him come get tested, because he's 86. I mean, 83. So dealing with a lot of the seniors, that's been my concern for those who are out. And I do have one concern, while people being out in the public with no mask, that concerns me, because I do have some health issues. Other people have health issues. So just being able to work with the BIPA to be able to give out masks, not only for the seniors, but for the children, and be able to, during this time of COVID-19, reach out to other families who are unable to go out to the store. So we'll be able to offer food boxes for them and any kind of resources that we can refer them to or we can get for them. That's what we do. So, but I'm just grateful just to be a part of this whole experience. And that's it.
Well, thank you so much, Jennifer. And also thank you for highlighting at least, how you've actually taken course and been one of, those folks who are finding out what is their status and also connecting those dots and the fact that you do have somebody that is near and dear to you that is within that high risk category. Thank you for all you do. And with that, I'd like to now introduce Charlie Cox with the Asheville Fire Department, who can also, kind of inform us a little bit more about another, different perspective of the COVID response and who you'll see as part of the team when you go to our testing sites.
Hey everyone, thanks again for having me today. I really appreciate being on this call. As the Asheville Fire Department, it's big for us to continue to be a stakeholder in the community and protecting and serving in every way we possibly can. And one of the biggest ways we've been able to do that recently, aside from being essential personnel and running on these COVID calls, is getting out into the community at these community testing sites and assisting with the COVID-19 testing. It's been my pleasure to work with Dr. Mullendor and Jennifer Poole from BIPA. I've gotten so much out of creating these contacts and understanding how they are a resource to myself and the department and how the department can be a better resource to these individuals as well. So it's been great. You'll continue to see the Asheville Fire Department show up and be present at the community testing sites. We were also at the testing site today at Altamont, so working with hand in hand with MAHEC. It's been pretty phenomenal to be a part of that. What I'd really like to address today is encouraging people in the community to sign up on the Community Connect. So if you go to buncombecounty.org or the City of Asheville's webpage, there's two opportunities to sign up on Community Connect, which allows the fire department to understand what are the things that you are wanting to put in about your home and your family. So you can sign in and create an account. It's very secure, and it lets us know how many people live in your home. Are you in a 1 or 2 story home? Do you have a basement? So anytime there's an emergency, we get that information real time on our phones and on our trucks, so we can better serve as we're en route to these emergencies at people's home. And there's also the opportunity to put in whether you're having COVID-19 symptoms. So just being able to put in if you have family members who are sick or are tested positive, that helps us do our job better and better serve the community. So that is a vital part of this community engagement. And what we're hoping is to continue to foster community resilience through these opportunities to share information back and forth. And it's not a one-time thing. If something changes and you don't have anybody who has COVID symptoms or any kind of mobility issues, but then that changes, say your family member moves in because they've gotten sick or they've experienced a fall, then you can go in and change the information or update the information on this Community Connect. And so it makes it a really great tool. It's a very empowering tool for citizens to be able to put that kind of information in and us be able to access it, to use it to help. So I really, really want to encourage the community to get out and sign up on that Community Connect and let the fire department know what your needs are, and so we can better protect and serve as we like to do. So aside from that, we are just continuing to roll through this and want to show up to these sites so that we can continue to not only assist with the COVID-19 testing, but also educate the vulnerable and high-risk populations on any questions they might have. So if you see somebody at these sites with a fire department uniform on, please don't hesitate to ask us about smoke alarms or fire escape plans, or we can help individuals get access to social services and mental health resources. we are active and engaged with our community, and it's very, very important to us, all of us here at the Asheville Fire Department, that we start to foster the resiliency that this community is going to need in this time while everything's been going on. So again, thank you so much for having me on here to speak about this, and I'm happy to answer any and all questions that come through as we move through this. And if I don't have an answer, I promise I'll find one.
Well, thank you, Charlie. And I think one other point before we do have Amparo share a little bit more about her work in this is, can you tell us a little bit more about the partnership that the fire department really has within our health? So I think we all think about fire, but what are the other ways that our Asheville Fire Department is really a key team member, and also our Buncombe County stations? How do they fit into the health puzzle?
Absolutely. So when it comes to health, people often really think of firefighters as just putting out fires, but a large portion of what we do now is medical calls. So if you dial 911, you're going to get a fire truck first, probably most of the time before an ambulance will show up, because there's more fire trucks than there are ambulances. So we're all trained to an EMT level, and some of us are even a little higher. So that is going to help us mitigate all of the health calls as they come in. So with any kind of trauma or cardiac or anything really, if you dial 911 for any kind of medical emergency or any emergency, truthfully, you're going to get a fire truck, and we're going to help you with that. And what we also want to be able to do is know that people can come into stations and get their blood pressure checked. And hopefully, as we move forward with this community action and moving into this engagement piece, there'll be more of an opportunity for us under a community risk reduction umbrella to help people manage with their medications, and just know that we are not just here to mitigate fires, but we're here to mitigate all kinds of disasters, medical, natural. Really, you throw it at us and we're dialed in to take it on. And that's what we want people to understand, is that the fire department, the Asheville Fire Department, is completely available to move through and educate on smoke alarms, car seats. Gosh, I'm trying to think now. It's like anything that you might have a question about as far as like managing your medications, helping with anything like that we can do. And we want to continue to do, especially in those high risk and vulnerable population areas where I think that population is underserved, and that kind of education will truthfully be even more of a benefit.
That is great. Thank you. Yes, it does. And I think in our previous discussions, one other thing that you did mention was CPR, and so if you want to elaborate a little bit more on that before we move on.
Right, absolutely. So I partnered before with Mission HCA, one of the trauma coordinators over there, and we have gone out into the community and educated middle schoolers on hands-only CPR and stroke recognition and basic first aid. So typically we would run a summer camp in the summer, and we would do a camp for middle schoolers, between like 30 of them between the ages of 11 and 13. And right now during these COVID times, we're not obviously doing that camp, but these kids would then learn how to essentially, especially in the vulnerable population area, there are a lot of children living with their grandparents. So what you might have is a situation where a child might know how to recognize the signs of a stroke that a grandparent is having and call 911 and really save that person's life. And so we are trying all the time to continue to be proactive in our education efforts as the fire department in reducing the risks of the community.
Well, thank you, Charlie. And next on our panel is Amparo Acosta with Buncombe County Public Health and our Communicable Disease Department. Amparo.
Thank you. So I want to walk us through what happens, when we get a positive COVID-19 case, and then mainly about what does it mean when we say we're doing contact tracing, because that's a very important tool in public health that we have had for a long time, not only with, to investigate cases for COVID-19, but before, like with tuberculosis cases or measles or, other diseases. So what happens, when you test positive for COVID-19, or if you test positive for COVID-19? Basically, your doctor will notify you of the results, or whoever did the test. That usually happens before you get a call from one of the communicable disease nurses in the county. Sometimes it can happen at the same time, sometimes it can happen later. But the hope is that someone will notify you that you are positive. Then our job in communicable disease in Buncombe County, we have a team of nurses that basically call and investigate, and not only investigate in the sense that, we just want to get data, but mainly we want to know how you're feeling. We want to know any recommendations that you need to consider to follow, and any resources that we can, give people with COVID-19 that might need help for. So basically, the nurse will call and ask you some questions, give you some recommendations, ask you how you're feeling. And then, we also ask about who you've been in contact with 48 hours before your test, if you don't have any symptoms, or 48 hours before your symptoms started, if you have symptoms. We are seeing a lot of people that really don't show any symptoms for the disease. So we will ask basically, who you've been in contact with. And this is anybody that, anybody at church, anybody at home, anybody at work, anybody at, a party you've been, anybody. And then, we give you some recommendations, like what does it mean to be isolated? The recommendation for cases is to isolate, really. And basically, no, people cannot go out when they're isolated. The recommendation is that someone that has COVID-19 needs to isolate for 10 days from the onset of symptoms and 72 hours without a fever and symptoms improvement. So those recommendations are for people that basically have symptoms. For people that do not have symptoms, the recommendation is 10 days from the day when the test was performed.
Amparo, can you, in very, very plain language, please, help us understand the difference between quarantine and isolation? Isolation is a word that we all have heard before outside of COVID. And so I think, folks may be very confused, but when we say quarantine and when we say isolation, what does it mean? And are there any differences between where you may be in your positive and your negative status with the use of those words?
Well, the use, it depends. If you have COVID-19, the word we use is isolation. If you are a contact to someone that has COVID-19, the word we use is quarantine. But really, the recommendations are basically the same, other than someone that has the virus. We recommend that that person stays in like one room at their house. They don't share a bathroom. They don't share any utensils. They don't share any food. They don't share anything, but basically what it means is you do not allow visitors in your house. You stay away from people, even in your home when you're isolated. You spend most of the time in your room, and other people do not enter that room. You use a different bathroom than anyone else. If you only have like one bathroom, you need to make sure that everything is clean. You stay at least 6 feet away from other people, and if that's not possible, you should wear a mask. You should wear, one very important thing is, and you'll hear this from everybody in public health, you should wash your hands a lot, and I see Dr. Mullender smiling. Like, I mean, that is just, it will seem that it's common sense, but it's just the best recommendation we can give someone. But basically, when someone is isolated, it means that you are pretty much by yourself in your house in a room. When someone is quarantined, you are still in your house. You're still not supposed to be out. You're still basically trying to prevent, in case you were like infections or are infections, you don't spread the virus. So basically, you're still staying home. And now, when we do the contact tracing with cases, basically we are collecting names of people that you've been in contact with, like I said, for the 48 hours before your symptoms started or 48 hours before you had a positive test result, if you don't have any symptoms. And the CDC says that a close contact is someone that you have been within 6 feet and for at least 15 minutes. So anyone that meets those guidelines is considered a contact, and will be basically given information and resources and advised to quarantine for 14 days after the last day they were exposed to a positive case. Does that make sense?
Yes, it does. Thank you. And so I think one of the other pieces that we absolutely will see here are questions around two things: privacy and stigma. And so how are you and the rest of the nurses on your team working through this?
So I will say that, we take privacy and confidentiality very seriously. We're not here to get anybody in trouble or to, point fingers at anybody. We're here to, like I said, to help and give information, recommendations, and mainly, make sure that people that had been diagnosed with COVID-19, healthy-wise, stay pretty much, they don't go into those, what do I want to say? Like, they don't become very sick. Like, we give recommendations, to basically stay as much as you can healthy and then prevent the spread of the disease. That's the main thing, because, we might not think that is that big of a deal because most people get better, but really it is a big deal for those people that have other conditions or their age, or, they're more at risk to get complications from the disease. So by basically doing the contact tracing, we are preventing the spread of the disease, or that's our goal. And again, we're not here to get anybody. We're not here to get anybody in trouble. We're not here to, mainly get anybody in trouble. We're not here to do that. We're here to try to prevent the spread of this disease, so that the people that are high risk, don't die, basically.
And so in thinking of, folks that are concerned about any possible, legal or work-related ramifications, how can you, how might this look differently for maybe those who are immigrant or who may be in frontline service jobs when it comes to contact tracing?
We treat everybody the same. We don't ask for any information that we don't need. We mainly want to make sure that people are healthy and stay healthy. I mean, that's our main goal. I will say, one of the things that people can do is people need to know that, our goal is to prevent the spread of the disease. And we will not ask you questions that we do not need to know. We will tell you about resources that are available for everybody. And our main goal is to slow the spread of the disease. One of the things that I will say is it's okay to answer our phone calls. Contact tracers have a very unique phone number that might look like one of those numbers from, I don't know, people that are trying to get information from us. I was trying to look for the number, but I cannot find it on my notes. But basically, the state hired a lot of people to help with contact tracing. So these people are calling contacts of positive cases every day. And they will always make a phone call first. You will not get a text, you will not get an email, you will not get, any other propaganda. They will actually pick up the phone and call you if you've been identified as a close contact to someone with the disease. And then they will ask you, do I have your permission to keep calling you? They will ask you a few questions, and then they'll call every day for 14 days. Some people choose to get communication via emails, and that's okay too. But the main goal is to stop the spread of the disease.
And I have the number, Amparo.
Okay.
I can share that. Yeah. So yeah, it looks like a telemarketer number, right? It's not a local number. It's 844 is the area code, 844-628-7223. So yeah, like Amparo said, it's, the goal is to quickly identify those people who are close contacts who could be basically, being infected as we speak, right? Who have been exposed, who might be developing the infection, and then could potentially spread it to others. And so the thought, this is like a basic public health practice, is to identify those people who are those close contacts, quarantine them away. Basically, they've been exposed but don't have symptoms, with the hope that if they did become infectious, they wouldn't be around anybody to spread it. And that's how we stop infection. And this is how we're going to get through this, like wearing our face coverings, keeping our physical distance, washing our hands, and if we identify cases, quickly isolating them, keeping them away from others so they're not spreading their illness, identifying those close contacts and keeping them healthy, keeping them safe, and like block the potential for transmission of infection. This is like basic public health practice in action on a massive scale. And it takes every single person, really stepping up and doing their part for us to be successful in this. So thank you, Amparo.
Oh, thank you. Another thing that I would say is that we don't just call to ask people questions and, get information. We also call, again, to make sure people are doing okay and to give resources if needed. We always give, the Buncombe County website, resource, the 211 resource, the North Carolina Department of Health and Human Services has a lot of resources. and the CDC. And yesterday, the governor announced the NC 360 program, basically for resources. You know, we understand that this is a hard situation for a lot of people, for almost all of us. And we never been to anything like this. I never been to anything like this, you know, and it's just real, and people are gonna have needs, and we're here to also, you know, give those resources, the information for resources that people can have during this crisis. And I just want to say, you know, some of the very important things that we'd like everybody to know, and make sure that you keep in your knowledge, is that, again, we're here to help, we're here to support, we're here to give you resources, and we're not here to get anybody in trouble. And I'll keep saying that. You know, and some of the things that people can do for us is, you know, make sure that you answer the phone when we call you. Make sure that, you know, you follow the guidance, the recommendations that we give you. And these are guidelines that have been proven to work. You know, we're not making this up. And basically, you know, we want you to notify your healthcare provider if you have any symptoms, any one symptom, so you can get tested, and that you stay at home to isolate and quarantine if recommended. You know, it's gonna take all of us to get through this. You know, everybody can help us slow the transmission. And all of us can help slow the transmission of this disease.
Yes, everyone. And so thank you, Amparo, and thank you to all our panelists. Now I want to pivot and really now get a chance to answer some of the questions that have been coming in through our chat. And this includes on Zoom, and then also for those that are joined on Facebook. The first question that I have, and Jessica, this is for you, is that can you, from your environmental health perspective, please clarify, are the wipes flushable or not?
The wipes are not flushable, not flushable. Wipes and other products that have the marketing line flushable, they are not flushable. They are not healthy for a septic system or for a sewer system. So the only thing that you should flush is toilet tissue and the product that you make when you use the bathroom. That's it. Nothing else should go into the toilet.
Thank you for that clarification. And I'm sure there'll be lots of homeowners that are happy as to not have the eventuality of needing a call. The next question, and I think this is for you, Dr. Mollendor, is that as we are seeing a spike in cases, why are some of our local hospitals allowing family members to visit patients? And so not sure if this is a question that we really need to reserve for our hospitals.
Yeah, I think that's a question for the hospitals, but the question was, why are they letting people?
Yes.
Yeah. I mean, yeah, I think that's a question for the hospitals. You know, I know that they have, you know, there's been some conversations and pressure on hospitals to allow, you know, more visitation. I mean, it's scary to be in a hospital, and it's scary to be alone in a hospital. And it's scary to be outside of a hospital knowing that you have a loved one inside who, you know, it's a scary situation. And so I think it's a balance between keeping infection at bay, right? Preventing spread of COVID-19, and trying to be mindful of the stress that it is to be in a hospital or have a loved one in the hospital. But I won't say more than that, because I do think that's a question for the hospital systems themselves.
Well, at least thank you for giving a little bit of a window into that. The next, and again, not sure, I'll open this up to anyone who may have a window into that, is what safety measures are there possibly within public transit? So if there's anybody who feels comfortable taking that on. I think that this is also specifically relating to ART. If anyone might be familiar with what current safety measures there are. This person looks like they're interested in having a full conversation, but wondering if there's anyone that feels comfortable at least sharing what the ART may currently be doing to ensure a safer riding experience for passengers.
Well, this is Dr. Mollendor, and I know that, we talked with them early on about, limiting the number of people who can get on buses. They've been boarding people from the back. The cleaning and disinfection practices have been increased. And I think there's the face coverings that the drivers are wearing and that I think are what I've read given out to those who ride. And so I don't anticipate at this point any change in those. I don't know of any changes to those practices.
We have another question, and this is regarding the testing experience. So if you could possibly answer it in two ways. First, what are the different kind of tests? I know we kind of tiptoed into that a little bit, into the different methods, how far up, and et cetera. But this person also wants to know, why are there no quick tests? So, what can folks anticipate in timing, at least in our mobile community sites? And maybe this is a question for Jennifer or Charlie, but Dr. M, if you can, please, from a clinical perspective, or Amparo, what exactly are the type of tests?
All right. Yeah, I don't mind starting. So yeah, there's many different ways to collect what we call specimens for testing for COVID-19. And so, the initial specimen that was collected was a nasopharyngeal. This is the one that people said it felt like they were tickling my brain. It's the long, thin Q-tip that would go straight back the nose and basically get as far back as possible. Because that's sort of typically for respiratory illnesses, that's often a gold standard, the best way to get a good sample to test for an infection. So that's probably one of the more common tests that's done. And then more recently, there's now a nasal swab, which just is a thicker Q-tip, a shorter, thicker Q-tip that just goes right inside the nostrils. And so there's also the possibility to get a throat swab for COVID-19. So all these tests per the CDC and the FDA, all those specimens or those sites of collection are considered appropriate and acceptable and good specimens to run. Now, the big thing about a test is it has to be collected correctly, right? So it has to, the person collecting the test needs to follow the instructions, and then the specimen needs to be stored correctly, and then the test needs to be run correctly. So all those things have a role. I know at our testing sites, I most recently when I've been there, they've been doing the nasal swabs, but I have, it all depends on what testing supplies they're able to get from the commercial lab that they're using. And again, one is not necessarily better than another at this point in time. It's just about, was it collected appropriately? Was it collected well? Was it stored well before it got to the lab to be tested?
Thank you. And so for timing, Jennifer or Charlie, could you touch on about how long are you seeing in our walk-up and or our drive-up sites? Does it take on average for testing, knowing that some of it is part of the sample collection, and then also some of it may actually be the paperwork?
It's actually been moving really quickly. I will say that last week we had 150 people tested on 2 different days, 150 plus, which is amazing. So we are out there for upwards of 3+ hours, and it's just, nonstop moving through these lines. And I would say that anybody, probably the longest somebody might have to wait would be 10 minutes. Honestly, it moves really quickly. It's a pretty efficient system. We've been doing it for weeks and weeks and weeks now, and we've actually got it nailed down pretty smoothly. So it's, they get greeted and we, with the drive up, we've actually been walking out to people's vehicles with our masks and our gloves and been handing out the clipboards ahead of time so that by the time they get to where they need to be the next station, their paperwork is already filled out. Also, people, as they've been testing, just to touch a little bit on the nasal swab, they have been showing up really concerned with the uncomfortability of the test and been reassuring folks that mostly it's been this anterior nasal swab. So it's been, like Dr. Mullendorf said, it's been the shorter, thicker Q-tip, and it's not been the touch the brain one. I got that one. It was unpleasant. That's not the one we've been using at the community testing sites. So everybody who's had a little bit of concern has been completely relieved to find out that it's not been a very uncomfortable test at all. And the folks administering the tests they're pretty much the same ones that come out every week, and they've been amazing.
Excuse me. So we have one final question, and this might be for you again, Dr. Mollendor. And this is based on what we're seeing in the data. So from what we're seeing in the data, who is getting sick? And is there anything that you could touch on related to what we're seeing in terms of community spread? Are there any unique populations aside from those in the long-term care facilities?
So looking at both our local data, our county data, as well as state data and national data, it's the age group. I think, from early on, we've been really focused on the 65 and older crowd because we know that they are at risk for really serious complications. But when we look at the number of cases, what we're seeing is that a majority of these cases are happening in 25 to 49-year-olds, young people, young adults. And so I think there's some thought that maybe people of that age group, and I'm in that age group, they see this as not as serious threat to them, right? And they're also the people, they're our workforce, right? So they're out there on the front lines. They might be essential workers, frontline workers. But I think what I've been reading is maybe our messages aren't getting into that crowd, that it's just something serious to take. And yes, you can become infected and maybe it's a mild illness for you, but it doesn't mean that that person that you had close contact with won't have a serious outcome because they have an underlying health condition or they're age 65 and older. So that's something that, we've been trying to work on. And then, as I mentioned before, there's the disproportionate impact on populations of color. And that I've spoken about this before, that ties back into racism and inequities and the social determinants of health, and where we know we have inequities in pretty much every health outcome, and COVID-19 is no exception to that rule and is really just laying bare all the deficiencies in our society when it comes to pretty much everything. And then the other question, was there something else I should touch on?
I think you
cases.
did. Yeah, and then just you did touch on where we're seeing cases.
Yeah.
That is in that 25 to 40.
Oh, and community spread. So yeah, so community spread. Early on when this whole thing started, we were really, we were seeing cases tied to travel, right? Somebody went on a cruise or came from an area of the country or of the world where there was a high number of cases. But it didn't take too long for us to start seeing, cases pop up just because people were going out into our community and couldn't identify the specific encounter that might have led them to get infected. And so we've been at that state of spread for quite a long time. And as things reopen, as people come out of their houses and go back, into the workplace or go out to restaurants or go wherever, now that they're able to go out, nothing has changed. COVID is still here. Nothing has changed with regard to, is COVID around? What has changed is we have more access to testing and we have better supplies of PPE, and our hospital systems are better prepared, but COVID didn't go away. And so I think it's really important for people to know that just because you can go out of your house and you can go places doesn't make those places safer.
Yeah.
right?
So
And so
I-
that's the face covering and the physical distance and the hand washing.
So yet again, the 3 Ws. I know we are, I'm aware of the time, we're slightly after our 2 o'clock, but in the interest of just making sure that this is informative, can you, Dr. M, as kind of part of your closing comment, and then want to go around and give everyone a chance to give a final word, address the value of testing. So there are some questions, and so why? So, how does getting tested and how does our community-wide testing really help in controlling spread?
So especially now that we know that people can be without symptoms or have very mild symptoms that they might not even recognize and be spreading infection, that's where testing really becomes important. When people had symptoms, we said isolate, don't go anywhere, and so that was pretty easy. But if you don't have symptoms and you don't know you have it, you're going out, you're engaging your normal activities, you could be spreading that illness. And so that's where, now that we have the increased capacity to do testing and the accessibility to testing, that's why the message has shifted and said, get tested if you have meet any of these criteria. Because the sooner we identify somebody with COVID-19, the sooner we can help keep them away from other individuals, make sure they, remain as healthy as possible, and then identify their close contacts and stop that spread. So that's, like we said before, that's how we're going to get out of this.
Great, thank you. Amparo, final word?
Yes, I will say all of us need to make the choice to help, our public health to fight this disease and to slow the spread. And that will help us, our families, and our community, to be more safe.
And Jennifer?
And I also like to say, we just like to make sure everybody's more educated about the COVID-19. We still have that little few that still don't know a whole lot about it. Make sure we practice the 3 Ws. And if there's anything that I can do as a community health worker or a community service connector, or through a BIPA, just let me know, and I'll build my.
Thank you.
Thank you.
Thank you. And Charlie?
Again, I just want to say thanks for having me on, and encourage the citizens to sign up for Community Connect so that they can give us all the information that they think is vital about their household, so that we can serve and protect them to the best of our ability. And again, with the fire department is going to keep showing up and assisting with the COVID-19 testing and in any other way we possibly can. So yeah, just remember to wear your face covering, do the social distancing, and wash your hands. Thank you.
Thank you. And to wrap us up, Jessica.
So my part about the mask is I wear my mask to protect you, and you wear your mask, face covering to protect me. And if we all can agree to do that as a community, then we can all help slow the spread and prevent COVID-19.
Thumbs up to that. And thank you for also leaving us on the reminder that this is indeed a collective and a community effort. Let's bend it like bunkum so that we can do this. So for those who have been participating in this conversation, we send our thanks and we remind you to, yes, again, exercise the 3 Ws. As a reminder, this conversation has had simultaneous Spanish translation, and both the English and Spanish will be archived and available on the Buncombe County Facebook page at the handle @BCHHS. And also for any of the other resources that you'd like around COVID or any other Buncombe County resources, make sure to visit us at buncombecounty.org. Until the next time, be well and stay safe. Thank you all.